Effect of education on adult mortality. Hello everyone, welcome to the Lancet Summer YouTube channel. I'm Dr. Armi Khavandegar, a medical doctor and medical researcher, and here we are with Dr. Payman Salamati, a professor at Tehran University of Medical Sciences, specialized in the field of social and preventive medicine. In this channel, we are going to summarize medical health topics recently published in the Lancet journal. Dr. Salamati, what topic are we going to discuss today?
Hello everybody. Many thanks Armin. For today, I've selected a specific article called Effects of Education on Adult Mortality, a Global Systematic Review and Meta-Analysis. It was published in the Lancet Public Health Journal in January 2024. And the authors are some of the IHME's collaborators. IHME stands for Institute for Health Metrics and Evaluation. And you know that IHME is an international research-based institute.
So, as far as I can remember, a couple of months ago, in this same channel, you discussed this issue by presenting it on the title of Science is Better Than Wealth, I think. What does our today's discussion add to the previous one?
The previous article named Educational and Social Inequalities and Cause-Specific Mortality in Mexico City, and it was published in the same journal in September 2023. However, there are two more advantages for this recent article. The first one is that article was an original article. However, this article is a systematic review and meta-analysis. And the second, the previous one evaluated people's educational level and its relationship with premature deaths. To be more precise, in the previous study, the researchers categorized people into 5 different groups, including illiterate, incomplete primary school, completed primary school, high school education, and tertiary education. And they could show that the higher level of education is, the more life expectancy will be. In other words, they showed that people with the tertiary education had longer life expectancy. But in this paper, the researchers were going to show how many percentages of death risks will decline following every additional educational attainment.
So, what are the advantages of systematic review and meta-analysis studies?
Another name for a systematic review is A to Z review article, and in this method, researchers are going to assess all of the papers which are going to answer a specific question to reach a conclusion. And if systematic reviews are along with meta-analysis, the researchers will put all the same data together to have a mega data and have a better analysis. You know that in evidence-based medicine, which is going to prioritize different studies, a systematic review and meta-analysis is one of the most valid studies in medicine.
So, in this research paper, the authors stated that globally all causes of death have decreases, and they anticipated that this kind of trend will continue. What's the reason? What do you think?
The reasons are related to improvement in determinants of health, such as access to health services, quality of care, technologic advancements, poverty reduction, access to water and sanitation, labor rights, and particularly access to schooling and quality of education.
Great. Could you please elaborate a bit more on the methodology of this research paper?
The researchers evaluated some specific databases including Web of Science, PubMed, and Embase. They extracted all of the papers published from 1980 to 2023. I mean about 43 years. And they evaluated 603 papers from 59 countries, and they considered the years of education from 0 to 18 and classified it as 6 years for primary school, 6 years for secondary school, and 6 years for tertiary education.
And what were the main findings that the authors of this research paper achieved?
They found on average for every additional schooling 1.9% of death risks can be decreased for adulthood mortality. And they discovered that such a relationship is stronger in lower age group. For example, the number is 2.9 for 18 to 49 age group, and it's about 0.8 for somebody's with more than 70 age group.
And what was the conclusion you get from this article?
You know, this is the first systematic review and meta-analysis quantifying the relationship between education and life expectancy, and it showed such a relationship with strong evidence, and we can conclude that education can increase life expectancy, and based on the results we should invest more on education for tackling with death inequalities.
Thank you for your time and overarching explanation. Thank you for watching us. Once more, the goal of this YouTube channel is to provide information about recently hot topics and papers that published in the Lancet journal. Don't forget to like this video, leave your comments below this video, and subscribe our channel.